Welcome to today's press briefing. We have with us from the Center for Health Protection Center, Communicable Disease Branch, Principal Medical and Health Officer Dr. Albert Au and Chief Manager of the Hospital Authority Dr. Lau Ka-hin. We'll first hear from Dr. Au. Good afternoon, everyone. I will now report to you our data from yesterday, that is the 16th of May. This is an update. We have 166 PCR positive cases. That includes 34 cases confirmed by the Hospital Authority, 43 confirmed by Public Health Laboratory Service, and the remaining 89 confirmed by private laboratories. And there are 162 RAT positive cases. We have 328 positive cases yesterday. So far, in the fifth wave, we have 1,196,437 cases, including 748,050 PCR positive cases and 448,387 RAT positive cases. Of the positive cases yesterday, there are 39 that are imported cases. The remaining 289 are local cases. Of the 39 imported cases, 23 were picked up at the airport. There are 3 close contacts because their companions have become positive, so they've been sent to quarantine centers, and then they were confirmed. And there are also 11 cases that were confirmed at a quarantine hotel: 2 day 3, 2 4th day, 5 5th day, 2 5th day, and 2 7th day. They are from the US, 9 cases, Canada 8, Singapore 3, Australia, Sweden, Taiwan, France, UK, and Thailand 2 cases each. Iceland, India, Spain, Vietnam, and the Netherlands 1 each. The remaining 2 imported cases are 12-day samples obtained at communicable testing centers. During the quarantine period, the tests were negative. After they've left, on the 12th day, it's a positive case. It's a 55-year-old male from India with a CT value of 36 that is high. Another one is a 34-year-old male arriving from Singapore. In March this year, this person was tested positive. We believe that these 2 cases are repositive cases. The samples are sent to the Public Health Laboratory Service for verification. Yesterday, at the Public Health Laboratory Service, 130 samples were analyzed for genome sequencing. We have not found any that is positive to L452R. 118 of them are negative, and for the remaining 14, there is insufficient viral load. In relation to full genome sequencing analysis, there were 3 previous cases from overseas. It's an 11th day RAT positive from the Philippines, and the other one is a 12th-day PCR case arriving from the US. These 2 people have been to Sun Mong Club. We've conducted full genome sequencing analysis. We found that the strain prevalent strain locally. That means that, after their quarantine period, they visited Sun Mong Club and got infected there. So these 2 cases are now classified as local cases. There was another case, a 12-day sample positive case obtained at the community center. It's a 24-year-old female arriving from Singapore on the 24th of April by SQ894. On the 29th, she finished the quarantine. On the 5th of May, she had symptoms, and on the 12th day, the sample was positive with a CT value of 24. Analysis show that is of a similar strain that is prevalent in Hong Kong. In relation to care homes, there was 1 care home for people with disabilities. It's a staff member. That care home has been infected previously, and that staff member worked on one floor. The last working day was the 14th of May, and the RAT test on the previously was negative on the 15th of May, and there are 8 residents. Well, there are 8 residents that are close contact and 2 staff members that are also classified as close contacts. They will stay at home for quarantine. This morning from schools, we have received 20 positive cases involving 20 different schools. 18 cases are RAT positive cases, 2 PCR positive cases. Sample taking dates are 14th of May, 1 PCR, 15 PCR, 16th, 6 cases, and this morning, 12 cases. Of the 20 schools, there are 2 kindergartens and childcare centers, 2 students, 7 primary schools, 6 students, and 1 staff member. 9 secondary schools, 8 students, and 1 staff member. And 1 special school, 1 staff member. For this special school and the staff member, it was one of the 2 staff members that one of the 5 close contacts related to the 2 staff members that were tested positive. So this morning, the close contact turned positive. The other 4 close contacts at the moment are still negative. The last working day is the 16th of May. The RAT yesterday was negative. So in this office, there are 3 staff members that are positive. We asked questions. They had eaten at the office with their masks off. They have not come into contact with any other students or teachers. Of the new cases today, we have identified 1 secondary school in which there is 1 student who was in the same class as another case yesterday. We found that in the classroom, they have eaten together with masks off. For both students, last day of school was 12th of May. One of them was tested positive on the 15th, and the other one was tested positive yesterday. Both students did not go to school after being tested positive. For the whole class in the RAT test yesterday and today, the results are all negative. There are no close contacts. In relation to death cases yesterday, there was no new death cases. In the 5th wave, we have 9,148 death cases. Death rate is still 0.765. Those over the age of 80, the death rate is 10.44. We would like to make an announcement about 4 new imported cases. After full genome sequencing analysis, we found that one is BA.4 of Omicron strain. It's a 43-year-old female arriving from the UK on the 8th of May. During quarantine period on the 5th day, the test turned positive. The other one is a 42-year-old male, also arriving on the 8th from the UK, asymptomatic. The 4th day RAT test was positive, and the 5th day PCR was positive. The other one is a 61-year-old male arriving on the 8th of May from Canada. On the 5th day, the PCR test turned positive. The last one is a 67-year-old male arriving on the 8th of May from the UK, asymptomatic. On the 5th day, the sample was tested positive. These samples have been sent to Public Health Laboratory Service. They're all confirmed to be BA.4. So far in Hong Kong, we have 7 cases of BA.4 imported cases. They were all either picked up at the airport or quarantine hotels. There is 1 from South Africa, 4 from UK, 1 from US, 1 from Canada. Last night, the FHB issued a compulsory testing notice requiring those who've been to this place between 11 and 1 p.m. on the 11th of May at Tam Jai Noodle Place in Tung Chung, Fu Tong Estate. Through our contact tracing, we found that 3 people who don't know one another visited that place around 11:30 to 1:30 on the 11th of May at this restaurant. One is a 32-year-old female. After the 11th, having eaten there on the 14th day, there was a symptom outset, and the test was positive. The other one is a 40-year-old male. On the 11th day, that is on the same day, there was symptom onset. The RAT test was positive. The last one is a 33-year-old male. He visited the place at noon on the 11th, and there was symptom on the 13th, and RAT test on the 14th was positive. In relation to these 3 cases, we conducted contact tracing and investigation. So far, we have identified 3 cases. We contacted the person in charge and we've sent colleagues to conduct site visit. We've obtained environmental sample to get an idea of the settings as well as the general situation. We have also obtained vaccine passes information. There are about 200 customers. We will issue SMSs to them to remind them that they have to be tested on a compulsory basis.
With regard to earlier groups, one is about the Imperial Kitchen. Today we have detected 9 new cases, including 1 working at this kitchen. And up till now, a total of 20 cases were identified, including 19 people who had been to the premises and also 1 staff member. And some of them did not have any symptoms. And for those with symptoms, most of them went there between 11th and 13th, and they developed symptoms during those few days. And we also interviewed them and we asked them as to what they did when they were there. And some told us that actually they went there to attend some friends' gatherings, and there were also some working meetings, and they also had some exchanges with their work partners and so on. And according to some cases, there were food being served. Food was served, and there was a celebration, and there was also a food tasting event. And some actually took off their masks and tried the food there. That's the reason why there was this small-scale outbreak. And up till now, 43 people who had been to this premises. They were customers and 4 staff members, and also 2 persons in charge of the private kitchen, and they all had to undergo this PCR test. And for the time being, we have detected 20 cases. And we understand that most of them have already undergone the test. Most of them got a negative test result. With regard to Star Cuisine, 8 new cases have been identified, 3 staff members, and also 5 customers were involved. And for the staff members, they included 1 working in the kitchen. And the last day of work was on the 9th of May. He developed symptoms on that day, and the RAT test was positive. And another one was working at the front stop on the floor, and they developed symptoms on the 10th and also the 12th, and one undergone the RAT test on the 11th, the other one on the 12th of May, and then for the rest of the remaining 5 are customers. So a total of 64 cases have been identified, including 55 customers and 9 staff members, and they developed symptoms between the 8th and the 14th of May. And roughly speaking, out of those cases, some 20 were asymptomatic, and the age range from 7 to 90. And the samples have been sent to the public laboratory, and some also underwent whole genome sequencing. And it's found that mostly is a BA.2.2 that is very common in Hong Kong, and that has to do with Sun Mon Club, and also the Peony Golden Quarter is also BA.2.2, but then the sequencing is slightly different. So for the 3 groups, they are not related to one another. Finally, it's about Sun Mon Club's update. Today, there is one new case involving one customer who had been there. Is a 56-year-old male. Well, he did not have any symptoms, and because of the mandatory or compulsory testing, he was found positive on the 15th. A total of 15 cases have been identified, including 13 customers and 2 staff members. That's the Sun Mon Club. And they developed symptoms between the 9th and the 13th of May. And as I said earlier, within this group, some of the cases have already completed the whole genome sequencing, and it's proven that is BA.2.2 Omicron, which is very common in Hong Kong, and that has also got to do with Sky Cuisine and another group, and also the Peony Golden Quarter is slightly different. Next, Dr. Lau. At present, some 686 patients have been confirmed, and they are hospitalized at the HA Hospital and also the North Lantau Infection Control Center, and also other facilities. And 66 are new patients that have been hospitalized, and 103 are now in the quarantine wards receiving treatment, and 19 are new cases. And for the rest, they have recovered, but then because of other medical reasons, they are continuing to stay in the hospital, or and they are not infectious, and therefore there is no need for them to go into the quarantine or isolation ward. Yesterday, there's no newly reported critical or serious case, and right now, for those who are still hospitalized, there are 10 critical cases and 15 serious cases. And 2 critical cases or patients are staying in ICU. Yesterday, there was no newly reported death case. During the past day, 88 patients recovered, including 70 being discharged. Since the onset of the 5th wave, 49,446 patients have recovered, 49,000 have already been discharged. And starting from 2020, we have a total of 61,826 patients who have recovered, including 61,380 who have been discharged. And one has been screened, or within in-hospital screening, he was confirmed, and 2 patients within the same ward have been classified as close contacts. As for staff of HA, 22,917 have been confirmed, and 22,766 have already reported to work. And there's a case involving Siu Lam Hospital. There's an in-hospital infection case. Well, for the Siu Lam Hospital serious mentally handicapped, there's one female who has been confirmed, and on the 14th of May, that's last Saturday, she developed fever, and then after undergoing testing, is a positive case, and now she is receiving isolation treatment. Her condition is steady. And 7 patients within the same ward were classified as close contacts, and they would have to undergo observation. And on the 15th, that is Sunday, we have already announced this case. As for the infection control unit of the hospital, it has already conducted contact tracing. It's found that a ward assistant for the ward has also been tested positive yesterday, and the hospital is now investigating the relationship between the 2 confirmed cases. and they've already suspended admitting patients, and also visit arrangements have been suspended, and complete sanitization has taken place. And Shilam Hospital has also arranged for all staff members and patients to undergo testing, and close monitoring will take place to monitor the conditions of staff and visitors, and we will maintain close liaison with it in order to follow up on the condition. Thank you.
Now the floor is open for questions. Please identify your outlet, raise your hand, and use the microphone we give you. I'm from TVB. First of all, I'd like to ask about Tongchong, the Tamjai Yunnan Misian. Does the CHP think that this is a location of a new outbreak? You said you send people to go to collect environmental sample. Have you done that already today? Any results? On the 11th of May, you said that between 11:30 and 1:30, those who've been there would have to do a CT and compulsory testing notice. What about people who go there outside that specific time? And altogether, how many new cases from schools today? How many students? How many teachers? In relation to the Imperial Kitchen in Kwun Tong, has the Department of Health decided whether the operation of that kitchen has violated any guidelines used? You mentioned about 43 customers and 8 staff members. Half of them have been infected. Has any regulations or guidelines been breached? First, in relation to Tamjai Yunnan Misian in Tongchong, we are conducting contact tracing to find out the whereabouts of the customers. We've only identified 3 customers who visited around noon on the 11th of May at that restaurant. We don't rule out other cases. We have to make use of CTNs before we find out. Apart from this specified period, we don't see any signs of cluster outside these hours. We believe that these 3 customers don't know one another. The only common factor is that they've been to this place to eat. One patient developed symptoms on the day when they went to the restaurant. For the other 2, after they've been to the restaurant for 2 or 3 days, they started to develop symptoms. They sat near one another. We don't rule the possibility that is the virus was transmitted because people had their masks off. We've obtained environmental sample to get a better picture. So far, the scale of outbreak at this restaurant is small. We've made suggestions to the relevant parties for thorough disinfection and for the entire staff to go through PCR tests. Our investigation is still ongoing. In relation to schools, we have received reports, 20 cases from schools, over 20 different schools. That's it. In relation to Imperial Kitchen, when we first identified this cluster, there were 9 cases. We asked questions. They said they went there to pick up stuff, pick up almond cakes and take away, and some deny that they've eaten there. When we identified further cases, we carried out investigations, and we found that for some cases, no plausible explanation has been offered. Further questions were asked, and we got the answers that about 40 people went there. They don't know everyone else. They are business partners or people with business dealings with some other people, and there was a meeting. Someone told us that there was food served and drinks served. Some people stay for over 2 hours with their masks off. We've contacted people who've been there. We will trace and follow the PCR test results as soon as possible to see if there are new cases. We've notified the FEHD to see if follow-up action needs to be taken next. Sorry, speakers off mic. It is a food manufacturing license. That's our understanding. The one at the back in brown. I'm from Hong Kong 01. First, you mentioned that from full genome sequencing, there was a 24-year-old male from Singapore. Can you give us more information about his whereabouts? What eateries has he visited? The second question is the effective reproductive number is risen to 0.99. It's a figure from the Hong Kong U. What are your views? What preparations do you have? We see from Sky Cuisine, Imperial Kitchen, and Tam Jai, there are cases. So what advice would you give to the general public when they dine out? Would you advise them to refrain from doing that? I want to ask about Imperial Kitchen. You said that it is a food manufacturing license. Under the current legislation, if someone sells food there or eat there, is a contravention of the law? Will there be prosecution action? The first question is someone from Singapore. We've already announced it is a 12-day positive case from Community Testing Center. We did not have full genome sequencing information at that time. It was a case from outside Hong Kong, and the tests during quarantine at the hotel was negative before the 12-day sample. At that time, we classified it as an imported case. For cases that are positive on the 12th day, we will ask for the sample from private laboratories for full genome sequencing analysis. And we find that it is a local case because the virus strain is very similar to local ones. We believe that that person entered the community after completing the quarantine hotel. It's not uncommon because we have about 200 to 300 cases a day in the community. So when you go out, when you go to places where there are other people, there is always a risk. We attach importance to 12-day positive cases. We will see if whether it is a repositive case, whether it's a local case or an imported case. If it's repositive, then we won't be worried as much. But if it is a low CT value, we wonder whether it's an infection at the quarantine hotel. We've been receiving results from these samples. Most of them are undetermined because of a low viral value. In relation to the effective reproductive number of the Hong Kong U, it was a question asked yesterday, the RN rate. We're not surprised by that. In the past 2 weeks, we have about 200 to 300 cases a day. It seems that it is static. It's static at a high level compared to the figures in previous outbreaks. In the past 7 days, the average daily number is 282. And the 7 days before that, the average number was 286. So in the previous 14 days, there is a slight fluctuation from day to day, but there are no signs of an increase or a decrease. This may be related to the gradual relaxing of social distancing measures. There are more premises or eateries being opened, the risk increase. More people go out to eat, and this increased transmission risk. from our investigation, we found that in the past 2 weeks at some restaurants that there might be outbreaks. And it's something that has been happening. So this may in turn increase the RN rate. We now see that the number of cases is rather steady. So for an infected person, they may infect another person, so the rate is 1. If it increases, that means the transmission is higher. Then there is a risk of an outbreak. So people should exercise vigilance and observe good personal hygiene.
Last question is about the Imperial Kitchen. As we are not the relevant enforcement agency, and therefore the case has been referred to the FEHD to take a look to see if they have flouted or violated any laws. The one in the middle row. I'm from Mingpao Daily. First, about TMHK Yunnan Mission. So how many staff members do they have? And have they complied with the requirements so that they do the RAT test once every 3 days? And is the result negative? And does any staff have to undergo quarantine? Because nearby there are also many people from air crews living nearby. So would that involve any air crew members? And also for the Imperial Kitchen, you said that there were friends gathering and also some work meetings and so on. So is it the same group of people? And who's the host? And also what's the nature of the activity? And also within the premises, what's the layout like? So when people went there, did they just sit around or did they just chat around and walk around? And also you noticed that the premises served food, but then there was no, they only got the food manufacturing license, and also they talk about buying takeouts and so on. So did they really do that? And also for the staff who had been infected, what was he responsible for? Thank you for your questions. The first question is about TMHK. We are still conducting investigation, and the initial understanding is that during that time slot, about 200 customers were there. So that's through the vaccination pass, and we gather the information through that, and we would be asking them to do the compulsory testing. For staff members, there were about 30. And for the time being, amongst the staff members, we have not been able to identify any positive case yet. And of course, we will only know after they have completed the test. And for the time being, tentatively, we haven't been able to find out the source of the infection because in the community, we have different infection chains, and some customers might have been to this eatery, and as a result, they might have caused this small-scale outbreak. That's something that we can expect. And we have already obtained the 3 persons' samples because they have all undergone RAT tests. We will arrange for them to give us a nose swab so that we can use that for a PCR test, and also at our laboratory there would also be a genome sequencing test to find out if they are one of the common strains. And also for the Imperial Kitchen, we went there and found out that the premises looked like a clubhouse. So there's there is a living room, and there's also a toilet and kitchen, and also karaoke facilities and so on. And we have also taken some environmental samples, and all of them have been found negative. So we have completed those tests already. We will continue with our investigation. We also made some inquiries, and according to some of those who had been interviewed, they provided some information to us and would be going back to them to ask further questions. Some of them told us that they were there to pick up some of the pre-ordered food, and others told us that they did go in and they did have food there. So according to our estimates, there might have been some sort of gathering going on, and they might have taken off their masks, and they might have consumed food there. As to whether or not that might involve violation of laws and so on, the FEHD will conduct further investigation. And then as far as we are concerned in conducting our investigation, we would follow up on whether or not anybody has broken the Prevention of Disease Ordinance, that is CAP 599J, by providing false information to our investigation officers, and if evidence is gathered, then we would also take appropriate action. Next, that gentleman. I'm from AM 730 about Tong Chong Tam Chai. So is it that the FDHD took the initiative to check the Leave Home Safe app before you found out? And also, you said that only where 4 cases have been found would you be announcing the name of the eatery. So is it that you have been able to do further investigation? And also for the Kwun Tong private kitchen case, you said that in the course of the investigation, there were some things that could not be explained. So what led to a different understanding on your part? Is it that for the 43 customers, did all of them take part in the event that evening? Or is it that some only went there to pick up the takeout and so on? And then for the Sky Cuisine, have you been able to contact all the persons that should have been contacted? And also for the 9 staff members, when they developed symptoms on the 4th day, did others also develop symptoms? And also for the students, as for other classmates that were not classified as close contacts, is it that they did not take off their masks and consume food inside the classroom or what? And also in recent days, how many people have been to the Siloam Hospital, and what's the findings of the initial investigation? What's the source of infection? Can you tell us? Well, I'll try to answer the first 3 questions, and then I'll ask Dr. Lau to answer the last one. First, about the Tam Chai group. We found out through case tracking or contact tracing, because during the infection period and also before they developed symptoms, where they had been. And these included using the Leave Home Safe app to collect the information, and we would ask the patients to upload the information from his Leave Home Safe app, so that we'd be able to find out where he had been during the incubation period, that is 7 days before the onset of symptoms. And we would then make a comparison and matching to find out if there are locations where they had been. And we would also do telephone interviews to ask which restaurants they had patronized, and we would also input the information into our system. And then we would use different ways to track down and find out whether or not there might be groups. In fact, there are quite a number of such groups, but then very often only 2 people were involved, and very often those would be very small scale groups, and therefore we did not specifically announce those, because those were not large-scale outbreaks, and therefore we just concentrated on the high-risk premises. For restaurants and so on, they would definitely be high-risk premises, and if there are gatherings, the present approach is that we would try to find out whether or not there is an outbreak. And secondly, we would also hope to use compulsory testing to find out that in the event of an outbreak, we would try to find out the hidden cases, because sometimes people might have patronized a particular restaurant, but then if he had not been infected, then he might not have undergone testing. And therefore, if we find out that there might have been an outbreak at a particular premises, we hope to send out the SMS to call upon those people to do the testing. And then for the private kitchens, when in the past few days we've been doing investigation, and we noticed that there were some things that have not been properly explained. For example, when we asked the patients, they say that they have had their mask on, and they would just spend a very short time in the premises. But then afterwards, we found out that if there is no common time where they would be at that location, because initially we only knew that there were 9 people. And then we tried to find out the source. And then after in-depth investigation, we noticed that there was further information, and also the tracking office would also review the CCTV footage. And then we noticed that there were suspicious clips. But then in conducting case investigation, we would trust the information provided to us. So we would very often follow up on the information provided to do analysis and tracking. But then in the event that we noticed that they were trying to hide some information from us, then we would resort to other means to find out more. As to the Sky Cuisine group, for the 9 staff members who were infected, as far as I know, they did not have any earlier experience or track record of being infected. They might have undergone testing, and for others, we will try to locate them to ensure that they would also do the test. As to the 2 students in schools, we noticed that, the 2 students, during their last day at school, it's already last week, and that's before the weekend, and then there was one on the 14th of May when he developed symptoms, and then on the 15th he was tested positive.
There is another one that's tested positive on the 16th. Within a very short time, there are 2 cases within the same class. We're concerned about a possible outbreak. We carry out investigation to see what these 2 students have done. We found that they know one another, and during recess they have taken off their masks and ate together face to face. We believe that that might be where the transmission took place. For the other students in the same class, they had their masks on all the time. That means they have practiced a good anti-infection measures. For the others, the RAT tests done today and yesterday were negative. So far, we believe that in this classroom, there is no outbreak. We asked the school to disinfect relevant premises. In relation to the female patient as Siu Lam, she's a long-term patient without having left the hospital premises on home leave. We're trying to find out the source of infection. We found that on the 8th of May, a relative of hers visited her. Yesterday, we asked the relative to do a PCR test. So far, the result is negative. There is a staff member that's positive. So we're trying to find out if they're related and if there are other patients or staff members that have been infected. So for all patients and staff members of Siu Lam, we will conduct PCR tests to see if there are any other carriers. Next, the one at the far side. I'm from cable TV. 66-year-old female died of myocarditis after having vaccinated with BioNTech, and she got $2 million in damages. How many days between the vaccination and death? We see that there are clusters from time to time in eateries, but there are relaxations of measures as well as extension of dining service. Are you concerned that there might be more clusters? Is it appropriate for such relaxation? And a staff member of the care home for people with disability, was their duties for the residents there, any of them being infected? In relation to the private kitchen, there is a room for mahjong karaoke. Did anyone use such facilities? Thank you for the question. What's your first question? For this case, is vaccination incident of concern. It's a 66-year-old female on the in July 2021. She was vaccinated with BioNTech, and afterwards she died. And we found that under the microscope that there was some traces of virus in her heart. She died of myocarditis. and in her heart tissue we found gene. We identified tiny viral genes, and that is one of the known side effects. So the expert committee is of the view that there is a link chronologically, but it is undeterminable whether the myocarditis is directly related to vaccination. Her case has been referred to the Hong Kong U for further investigation, and the information has already been outlined in the report dated the 10th of December. In relation to relaxation of social distancing measures, of course, with the relaxation, the transmission risk may be higher. People go to restaurants to eat and they would take their masks off. Currently, restaurants are covered by vaccine pass. So when you go to restaurants to eat, you will be vaccinated with 2 or 3 doses. Vaccination is not an effective means against infection, however. The risk of serious cases, hospitalization, and fatality is greatly reduced. It is something that we can do against the backdrop of manageable risk. So we have to factor in convenience and necessities of members of the public. We ask members of the public not to let their guard down with these relaxations. If they have symptoms, do not go to these places. Do an RAT. If you know that you have come into contact with positive cases or RAT positive cases, please do not go to these places. In relation to the staff member of care home for people with disability, the person is in charge of personal care and feeding. During the hours of work, that person would don full personal protective equipment, that is face shield and masks. The person takes care of residents at the care home out of caution because of the high risk of transmission in a care home. So we arrange for uninfected, those who have never been infected, to stay in a quarantine center. Thank you. That's the end of the press conference.